Time now to tackle some of your health questions, and joining us with all the answers is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks as always for stopping by.
Good to see you.
Good to see you. We've got some timely questions for you this time around. We'll start with heat stroke. This first viewer wants to know, does heat stroke strike often, and what's really the best way to prevent it?
Yeah, it's that time of year again. And, you know, the spectrum of heat illness is very common. Fortunately, though, heat stroke is not. We only see about 200 deaths per year in this country, and the main reason for that is because we have the resources to be able to prevent it. So what is heat stroke? Well, what it is it's when your body reaches temperatures of 104 or greater because of its inability to be able to cool itself any longer, secondary to a number of different reasons, but from external sources. So, for example, the most common is you're not able to sweat any longer. Why? Because you're dehydrated. And so then what happens is you become very fatigued, weak, severe headache, nausea, vomiting, and then the hallmark symptom is neurologic changes. You're delirious, you're agitated, you can be very confused. So those are the things that we look for. So the key, though, is preventing it. And a lot of it can be common sense, but I love to make sure that we refresh and remind everybody as to what to do, because it's easy to get to that point in this weather. So, number one, drink plenty of fluids. Wear loose-fitting clothing if you're going to be outdoors for any prolonged period of time. Take some rest breaks every half hour or so. Sit down for 5 or 10 minutes in the shade. Take a break. Try not to do any strenuous activity when you're in the heat, and avoid alcohol, and make sure you check with your doctor about certain medications that can prohibit or eliminate your body's ability to cool itself. If you do that, and you're going to be in much better shape.
So if you've gotten to heat stroke, that's pretty severe.
Yeah, without a doubt.
All right, our next question for you, what's the best treatment for swimmer's ear?
Yeah, well, have you ever had it?
I have not.
It is a very, very painful thing. And that little canal inside your ear can be very painful. And the key is in swimmer's ear is, again, preventing it, and it's simple to do, because look, we're all going to do some swimming, and if you can prevent that water from sitting in the ear canal and causing an infection, you're much better off. So what do? Well, clearly try to prevent water from getting in your ear. Wear earplugs when you're swimming. Don't stick anything in your ear to clean your ear, and that includes Q-tips. That can scratch the ear canal and contribute to an infection. If water does get in the ear, try to dry it off, put an ear wick in there or a cotton ball, and you can even use a combination of alcohol and white vinegar.
Some drops.
Yeah, put a couple drops in there. That'll retract the water and prevent the infection from occurring. Okay.
It kind of feels like an earache.
It really does. Well, it's much, much worse, actually. You pull in there, it's very tender. So if you need to treat it, then the key is irrigating it out, hydrogen peroxide and water, and once you irrigate it out, then you put the drops in, but they need to stay in with a wick. It's very painful. It has to occur 4 times a day. You don't want to get to that point.
All right, prevention is the key. All right, thank you so much. That's our time with Dr. Soria for this week, but if you have a question for him, you can send it by going to our website, WPTV.com. Just click on the health link there. Scroll down, and over to the right, you'll see a form to send Dr. Soria your question. Thanks again, and we'll see you right after the break.